A UW-Madison student is taking action on what he is calling a mental health crisis on campus. Leland Hermes has started a petition for UW to provide more mental health care for the student body. Our Andrew Banstra has the story.
For this UW senior, mental health hits so close to home, he had to do something about what he calls a mental health crisis on campus.
I lost my dad back in 2020. He took his own life, and so I've always just kept that close to my heart. And so I really just don't want people to be in that same scenario.
After a UW student died unexpectedly on campus, a UW senior, Leland Hermes, started a petition asking the University Health Services to double their staff for mental health services.
So we have our own 1,600 signatures currently.
Through UW's UHS, students can find a therapist. He says right now students are telling him that after a screening process, they're waiting about a month for an appointment, leaving many students alone in their worst moments.
People have been going to UHS for a long time trying to get the help they need, and they get turned away, or they just don't have enough therapists.
The American Psychological Association says 60% of college students have a mental health problem. At UW, there are nearly 50,000 students, but only 75 UHS employees are listed on their website that are designated for mental health services. He was crystal clear this is not an attack on UHS, who he says are working tirelessly.
It's a limited resources issue for them, and I think that's really where our concern is they need to get the help that they need as well, because then they're drained and they're trying to help us out.
In his opinion, it's a staffing and resources issue.
Even if you can't get that help, you can't reach a therapist, try a crisis hotline, try something, anything, just don't go there,
Andrew Banstra reporting. In a statement from the executive director for University Health Services, Jake Baggett, to News 3 Now reads, in part, quote, "We are also aware of perceptions on campus that students cannot access mental health services within the time frames they need. It is important to us that students have clear and accurate information about what is available to them and how to access critical services for mental health, especially in times of crisis." Leland told News 3 Now that he has a meeting with UHS later this week to discuss ways UHS can best serve the student body.